Hello, good afternoon everyone. I am Dr. Kedar. I am a consultant pediatrician in Lotus Hospitals in Kukatpally. So along with being a pediatrician, I am also a pulmonologist. I take care of allergy and applied immunology as well as infectious diseases here at Lotus Hospitals in Kukatpally. Today we will be discussing on pneumonia. Now what is pneumonia? See, basically pneumonia is nothing but infection and inflammation of the lung tissue. If a bacteria or a virus enters into the lung tissue and starts multiplying inside that and starts to damage the lung, it is called as pneumonia. Now, how do we classify pneumonia? Pneumonia is basically classified as being bacterial pneumonia, viral pneumonia, or other miscellaneous causes. As we all know, bacterial pneumonia constitutes the major chunk of all the infections in India. Viral pneumonia is very common during seasonal peaks, and other miscellaneous causes also have inclusion of chemical pneumonia like ingestion of kerosene or petroleum products. I will discuss in short about all the three variants. Coming to the bacterial pneumonia, this is the most important cause of pneumonia in India, and it is one of the leading cause of death in under 5 children. And this particular thing is so rampant in India that it is always difficult for us to diagnose. Usually the clinical features are high-grade fever, cough and cold, and often associated with breathing difficulty. And viral pneumonias are basically more predominant during the fall and the winter seasons, especially during rainy seasons also. This constitutes more of respiratory syncytial virus and influenza virus. The influenza virus and respiratory syncytial virus are the most common causes of viral pneumonitis. And coming to the miscellaneous causes, this is usually caused by chemical pneumonia or inhalational pneumonia. Usually sometimes we come across children who accidentally ingest petroleum products like kerosene or tinner, the paint tinners. This usually becomes a vapor and by way of inhalation goes inside the lung and damages the lung tissue. This we call it as chemical pneumonitis. Coming to basically the common symptoms that are usually encountered in pneumonia, the most commonly we see fever, cold and cough. And other symptoms of a severe disease would include onset of respiratory difficulty. The patient usually has difficulty in breathing and also drop in oxygen saturations as monitored in the pulse oximeter. So basically, when to visit a doctor is the most important take-home message of this talk. Usually when there is a high-grade fever exceeding beyond 102 associated with rapid breathing, and which is wherein the child presents with decreased activity, lethargy and difficult to feed and constantly in a sleepy mode. These are the hallmark features where you should visit a doctor, you should seek medical attention immediately. The basic investigations that are done by any doctors are a basic blood checkup to see the intensity and severity of infection associated with an X-ray to find out the extent of the damage of the lung. And usually there are two types of therapies that are usually given. For mild to moderate disease, home therapy is recommended, wherein an empirical antibiotic is usually started along with other supportive care like paracetamol, etc. And sometimes even nebulizations are also prescribed when the amount of the phlegm or the respiratory difficulty is more. In severe cases where the oxygen saturation is dropping, or if the doctor feels that the child is more sick, dehydrated, dull, not accepting feed, in these scenarios, the doctor might advise hospitalization and commencing on oxygen, nebulizations, intravenous antibiotics and supportive care. Like if the child doesn't respond to oxygen, then higher modes of artificial breathing may be instituted, like high frequency nasal cannula or a mechanical ventilation. Coming to the most important aspect of how to prevent this, there are vaccines available. Vaccines are usually directed to prevent the bacterial pneumonias and the viral pneumonias. So the pneumococcal vaccination, pneumococcal conjugate vaccination is usually given at 6, 10 and 14 weeks of age, associated with the flu vaccine shots given at 6 and 7 months of age in the first year, and subsequently once an annum till 5 years of age. So my dear friends, please remember that vaccine preventable diseases constitute one of the vaccine preventable disease is pneumonia, wherein we can vaccinate the child against pneumococcal diseases as well as flu. This prevents the spread and incidence of pneumonias. Thank you.
Hospitals is one of the leading brands for all your health needs. You can visit our expert doctors at any of the centers: Lakdi, Kukatpally, Nagar and Vizag. For booking an appointment, you can use our app or visit www.lotushospitals.in or call on 040 4040 4444.